From Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about cardiac athletic screenings for adolescents, a program at SMH, and it's protecting them on and off the field. Our guest today is Miranda Sturgeon, who is the coordinator for CASA at SMH, and she is also the manager of cardiovascular diagnostics. Miranda, thank you so much for being with us.
Thank you for having me.
Can you start by just giving us the basics of what the CASA program is?
CASA is a completely free cardiac screening for our student athletes. We start with an EKG and a blood pressure check. We ask them to fill out a questionnaire, and we look at all three of those factors to see if there's any concerns with their cardiac.
Why did you decide to bring this program to SMH?
It's a personal touch for me. A friend of ours lost their daughter at 13 years old from a cardiac condition that they didn't know she had. And I started researching it, and I found out that it's not as uncommon as we might think. It affects about 2,000 individuals under the age of 25 every year. And I wanted to bring that to Sarasota and prevent these events from happening to our community kiddos.
What can cause these sudden cardiac events during participation in school sports?
A lot of the conditions are unknown. Students are unaware that they have these issues. Most common ones that affect our students are hypertrophic cardiomyopathy, coronary artery anomalies, and other things that we can pick up in these screenings and prevent them from having a sudden cardiac arrest.
So for parents of student athletes, how does screening work if they sign them up?
They will set up an appointment with me. I will email them the consents and the questionnaire. They'll show up to their appointment. We'll review the questionnaire. We'll do a blood pressure and an EKG on their student. The cardiologist will review all three of those factors and see if there's anything of concern, and then we'll do a limited echo if it's needed.
What tests are performed maybe as secondary if some anomalies are possibly detected or they're concerned? Are there secondary screenings?
There'll be follow-up. If there's any concerns with the cardiologist, they recommend follow-up either with their primary care physician, or if they want to see them, the pediatric cardiologist that we use, they can follow up with them for those conditions if we find any.
And how long does the typical screening take?
Only 15 minutes at most. It's very quick, very easy.
Why is it so important for our student athletes in this community to take advantage of this program and have these screenings?
It's important for preventative purposes. You know, the first symptom that children have with these conditions is sudden cardiac arrest most often. And so this is a preventative measure that we can take.
You mentioned a few of the most common abnormalities. Are there any others that are notable that parents should be aware of or that they might hear about during these screenings?
There's some EKG abnormalities that they might hear in these screenings, and some of them are actually normal for student athletes, which is why it's also very important to have a very trained cardiologist, pediatric cardiologist, read those EKGs to determine what's normal versus abnormal for these students. But more times than not, they're completely normal.
And many of the abnormalities you mentioned don't have symptoms until sudden cardiac arrest. So it's not something that student athletes would notice without these screenings, correct?
Right. Oftentimes, yes. Or as they grow, as they get older, they start to experience chest pain or shortness of breath, and then those are our first signs.
To put parents' minds at ease, though, most of these screenings detect nothing, correct?
Absolutely. Most of them detect absolutely nothing. This will be our 5th year running, and we've only had 2 critical cases.
So it's really just peace of mind.
Absolutely. Just peace of mind for the parents and the students.
What has been the reaction of parents and students who have taken advantage of this program and had that little bit of extra peace of mind?
Complete gratefulness and humbleness. They are so thankful that we're doing this for their community.
And the CASA program, SMH partners with Johns Hopkins All Children's, correct? Can you talk a little bit about that?
We do. Our pediatric cardiologist medical director, she is phenomenal, and it's her and her partner through Johns Hopkins All Children's that volunteer their professional time to run these screenings with us.
So while most of the screenings are completely normal and it's just that peace of mind, I know there are a number of stories of this program truly helping student athletes before something which could have been a potentially fatal event. Do any in particular stand out to you?
Absolutely. We had a student last year that stands out. Caesar had a normal EKG, but in his questionnaire, he said that he was experiencing chest pain. So we performed a limited echo, and we found an anomalous coronary artery. So Caesar went through the follow-up steps. He had a CT confirming the anomalous coronary, successful open heart surgery next month, and he's already returned back to track and field.
What does it mean to Caesar? Like, can you talk a little bit about his family's reaction that he's able to get back to doing what he loves? Because I know he in particular is very motivated in track and field.
Yes, Caesar is why we do these screenings. He had an anomaly that could have been a fatal event. And the fact that we found this in a screening is such a huge relief for the family and for Caesar.
And to learn more about that, I just want to share Caesar's story is actually available. He shared it with us himself. You can visit smh.com to see that. You can also visit youtube.com/smhcs, and Caesar's story is there for the CASA program. Why do you think it's so important for parents of student athletes to actually seek out these screenings for kids, find out when the next available one is, and get their kids signed up?
It's so important for peace of mind for them. It's important to make sure that you know your child is safe and there are no concerns that they're going to have an event on the field.
How often does the CASA program hold these screenings? How often should parents be looking out for them?
We run the screening once a year, but for 2 weekends at that time.
And how many appointments are available? How many kids can get in? Is it a limited number of spots?
Not really. We can see up to 80. We have 80 slots that we can see students, but we'll take you if you come.
So while it's called cardiac athletic screening for adolescents, can you clarify who is eligible to receive these free screenings?
Absolutely. We screen 12 to 18-year-olds. And the reason that we have that age group is because it's been identified that that is the highest risk. That age group is the highest risk.
And is there any requirement to proof of being involved in any athletics or anything like that?
Not at all. Not at all. The questionnaire asks what your child does, and that answers it for us.
And what does it mean to you and to the others who participate in running these screenings to see how many student athletes actually take advantage of this?
It's really assuring, and it's really humbling to see as many students as we've seen. I really care about our community, and I want to make sure that everybody is taken care of. And if there's something we can prevent from happening, I'm all for it.
Is there anything else you want people to know about the CASA program?
CASA is completely free. There are no obligations with this screening. Come in, let us screen your kids, let us give you that peace of mind so that you can go back on the field and feel confident about your health.
How can parents learn more if they're interested and want to find out when the next screenings are coming up?
They can give me a call. The number is 917-1190, and I'd be happy to talk to them.
Thank you so much for joining us today, Miranda. As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial.